Welcome, Common Sense Patriots, to this episode of Common Sense for America. Today we focus on our national health care and its related expenses. Nothing can be more personal to us than our health and that of our loved ones. For many, acute and chronic health care issues are the greatest challenges their families will face. Now, health care is the single largest part of our economy. About 17.6% of our economy in 2024 is for health care. The national cost is $4.8 trillion. Yes, I said trillion with a T, and it's going up faster than inflation as a whole, and faster than our economy is growing. The average American can expect to incur between $300,000 and $400,000 of health care costs over his or her lifetime. Women tend to incur more costs because they live longer than men. Now, these costs can bankrupt a family, and they can prevent kids from going to college, even causing families to lose their homes. About half of our health care costs occur after age 65. That's not a surprise to anybody. And 25% of our total health care costs occurred during the last year of our lives. That is a surprise to a lot of people. Most of us have some kind of insurance to deal with these costs. About 2/3 of us have private insurance through our work, and about 27% have some form of government health insurance like Medicare, Medicaid, the Affordable Care Act, which we call Obamacare, the VA, or other military insurance. Now that leaves about 9% of us who have no health insurance at all. Now we call this a mixed system, or at least the government calls this a mixed system of national health insurance. While these programs can provide very good care outcomes, they are terrible at controlling costs. Our health care costs as a nation are going up about 7.6% per year, much faster than the growth of our economy. This puts a great strain on families to keep up with increasing health care insurance premiums and other costs like prescriptions and chronic care procedures such as kidney dialysis. Yet there are some parts of healthcare where costs are not increasing. Cosmetic surgery has advanced significantly from a technological perspective. Its cost has increased by only an average of about 1.34% per year since 1998. Very low cost increase. LASIK eye surgery, and I'm a beneficiary of LASIK eye surgery in both eyes, have gone down 20% in the last decade. I said down 20%, not increased, but down 20%, while becoming significantly more advanced and effective. Now, how have these two areas bucked the trend so dramatically? Both these procedures are not covered by insurance, requiring the patient to pay 100% of the cost out of pocket. The patient is completely in control of the selection of the service provider and the decision to buy or not. Competition has therefore controlled and reduced the cost of these procedures. How can we bring that same kind of competition into our mixed system of national health care? Well, first, we need to require that health insurance providers pay their benefits to the patient's health care insurance account, which is controlled by the patient. We don't want them to pay it to the healthcare provider. We want them to pay it to the patient. The insurance provider must be required to publish the amounts they will pay for each medical service or procedure and make this available to the patient who is shopping for insurance. Now, the insurance provider will pay the published amounts to the patient's health and insurance account. Just as Medicare does today, Medicare publishes the amount that they will pay for each procedure, but Medicare pays the service provider, not the patient. So we want the insurance companies to pay the patient, but not the healthcare provider. The insurance provider will also be required to consult with the patient as to the need and the relative cost of the subject procedure or service. Now, this consulting service is a new idea to help patients make more informed decisions. The patient then shops first for his insurance provider, and then he gets comfortable with that. He's got his insurance provider, and they're consulting with him when he needs it. And later, he's shopping for the healthcare service provider to treat the illness or the condition at hand. The patient is in complete control of who provides his health insurance and who provides his or her health care. I like my doctors, and I want to stay with them. In this system, that is my choice. We were promised that in Obamacare, but that turned out to be a lie. This system would introduce competition and control costs much more effectively than anything else we can do. Now, this change should work well for private insurance, for Medicare, Medicaid, and Obamacare, the Affordable Care Act. The VA could also implement this system by providing veterans with health care vouchers instead of cash, if that were the case. The VA patient could use the voucher wherever he wanted to go for his medical service. This will work to control costs, but it will not control the increasing needs for health care. We are an aging population. I mean, look at me, I'm a boomer and I'm aging fast, and our health care needs are increasing every year. We need to find ways to reduce the amount and the frequency of disease in our population. Remember, I think it was Benjamin Franklin who said an ounce of prevention is worth a pound of cure. So what are the causes of our illnesses? The main diseases that we're dealing with? Those are heart disease and stroke, cancer. Diabetes, $237 billion per year. One out of every 4 healthcare dollars is spent on diabetes. Obesity is a root cause of diabetes, heart disease, stroke, cancer, and a contributing factor for arthritis, and I can attest to that. I have arthritis. Alzheimer's disease, $321 billion this year will be spent on Alzheimer's, and that's forecasted to increase to $1 trillion by 2050. Epilepsy, believe it or not, is another terrible disease that is common in our society today. And the old-fashioned tooth decay. 1 in 6 children and 1 in 4 adults suffer from tooth decay, diseases from tooth decay. $46 billion a year are spent to deal with this health issue. Now, a lot of these diseases we bring on ourselves, and I freely admit that I'm as guilty of that as anybody. Inactivity and diet are the leading cause of obesity, which leads to many other diseases, as we've just discussed. Tobacco products are a major cause of cancer and heart disease. Excessive alcohol use is a killer among people aged 20 to 49. And alcoholism is a chronic disease that contributes to all manner of other diseases and mental illnesses. What can we do about these diseases? Well, first, we can attack the causes we can easily control. But let's deal first with the things that we can for sure control. We should increase the federal taxes on tobacco and alcohol dramatically. We know from past experience that this will work to reduce consumption of tobacco and alcohol products. Obesity is the root cause of many serious diseases, and so we've got to deal with obesity. It's an epidemic in our country. Did you know that 1 in 3 young men aged 17 to 24 are too fat to be enlisted in the Army? We must reintroduce physical education in our schools in a big way. We should require physical activity as an extracurricular activity throughout the entire educational experience, even in college. We should consider 2 years of mandatory military service for all men and women, not only to protect the nation, but to build up their bodies and prevent obesity. We should also tax the foods and the food ingredients that make us fat. Now, I don't say that we can tell people what they can and cannot eat. I would never suggest that. But we can make it more expensive for them to eat themselves into obesity. Remember, an ounce of prevention is worth a pound of cure. Now, what foods are making us fat and what are making us sick? Well, refined sugar and products that rely on refined sugar and its sugar substitutes like sugary soft drinks are big offenders. We should tax these products like alcohol and cigarettes. Fried food is another major contributor to obesity. We should tax the fats and the oils that fry these foods. Notice that we don't need to advocate banning these foods. People have a right to choose what they eat, but if they choose to eat these things that make them sick, we should at least get some tax revenue to discourage the choice and compensate for the national cost that the eventual health insurance and treatment costs will incur. We know from our experience with tobacco and alcohol that taxation will discourage consumption and save lives. We should pass a law requiring all health insurance policies to require annual preventative health consultations with patients, doctors, and dentists. Grade school nurses should perform this function and discuss the results with parents. School curriculum should be reintroduced, mandatory health classes to educate kids as to how to protect their health, including a proper diet and dental health. Clearly, there is much we can do to protect the health of our people. This falls well within our 4 principles of good governance: life, liberty, happiness, and self-reliance. When all else fails, we are still faced with end-of-life issues. When all else fails, we all die eventually. Remember that 25% of our lifetime healthcare costs occur during the last year of our lives. Let me repeat that. 25% of our lifetime healthcare costs occur during the last year of our lives. Some of us are afflicted with chronic conditions that make life virtually unbearable. Some of us will face terminal illness that cause us tremendous pain and expense. When this occurs, some of us would like the option of death with dignity. This should be a patient's choice, made within the context of their religious beliefs and with family at their side whenever possible. Certainly, there should be procedures to ensure that the patient is not making such a choice without being fully informed, that they are making that choice of their own informed free will. If that is the case, who am I? Who are we to say, who is the state to say that they cannot make such a choice? This is a states' rights issue. Each state must decide this matter for themselves. Now, at this very moment, the governor of Delaware has vowed to veto a death with dignity law passed by the legislature with the support of 72% of the population of Delaware. And he has said that out of conscience, he will not support any law that allows anyone to take their own lives, no matter how dramatic the issue may be for that particular person. Who is he to make that decision for someone else? I mean, I understand his own conviction. He would never commit suicide. I get that, and I don't fault him for that. But he has no right to say that if I were dying of terminal cancer and in tremendous pain, that I couldn't choose death with dignity. That's my belief. I'm giving you my personal beliefs now. We know that prevention can control these diseases and control these costs. We know that if we had a more active lifestyle, if we control our diet, and if we eliminate alcohol and tobacco from our diet, that maybe 40% of our chronic diseases like heart disease, stroke, Alzheimer's, etc., that maybe 40% of these diseases would be depressed or go away. We know we can do this. I urge you to please discuss these thoughts with your friends and family. They may be surprised by some of the facts you share with them. Please get their ideas and share them with us. We love hearing from you. Now, please plan on being with us the next time when we will discuss our education systems and school vouchers and their impact on our educational outcomes. Until then, God bless you and God bless America.